a lot of it is more than just like this person has, a chronic pain in their low back. They just need a good crunch and it'll fix it. Like a lot of times it goes a lot deeper than that. Generally past like the 3-month mark, this is for most things, most injuries, most pains, past the 3-month mark, barring some sort of major injury like a broken bone or something like that, most injuries at least, past the 3-month mark, there is something more going on. Because most things heal before that 3-month mark.
Yeah. Hey everyone, Robert Grigore here, the Mental Health Show with Robert Grigore. I wanted to pop in here and share something with you that was, very transparent and and honest and very authentic about an interview that almost didn't happen, and then when it did happen, it almost didn't happen again. So let me share what happened here. So about a month ago, I reached out to a wonderful man named Dr. Tyler Lamerante. He's the chiropractor and owner of Murrayville Health and Wellness, really, really nice little clinic in Murrayville, Langley, BC, Canada. And I reached out to him and I said, hey, would you like to be a guest on the show? I've done some research on you. You seem like you'd be a really terrific guest. I want to do a show about mental health meets physical health and all of that. And he said, yeah, sure, it sounds good. He said, is stretching out of his comfort zone a little bit, but he'd be willing to give us a shot. I said, oh, that's so on. Thank you so much. Anyway, about 3 days before the interview comes, I get hit with a very nasty cold. I can barely speak. I can barely swallow. There's no way I can do an interview. So I, sadly reach out and apologize. I can't do the interview. I hope you don't mind. And he said, you know what? Thank you so much for letting me know. I got a 1-year-old at home, so I definitely don't want to get her sick. And I was like, okay, I feel that, right? Because as a in-person service provider, the last thing you want is for a client to come in who's sick and then get you sick. And then that means that you might get other people sick, and it's just an all around, not good situation. So anyway, so we reschedule a couple weeks later or something like that. I'm feeling better. I'm like, okay, let's do this. And then unfortunately, we had a death in our family, and it required us to travel way up north in BC. And then so that actually coincided exactly, as you can guess, with the interview with Dr. Tyler Lamerante. So I said, yet again, sorry, Dr. Tyler, I'm going to have to, again, reschedule. This is what happened. I'm so sorry. Would you please, possibly, give us another chance here? And he said, absolutely not a problem. You pick the time. And I suggested, the date that we did it. And then I show up. I spent the day beforehand, like 6 hours or more, making sure all of the gear works just properly for this really important in-person interview. And I finally get there. I'm setting everything up. And then guess what happens? I forget to hit the record button on my camera. Can you believe that? An in-person interview, and the host doesn't even record himself with his own camera. So anyway, what did happen is, Dr. Tyler has his camera, and there is a wide-angle shot where I am asking questions. So I the interview was just so good and so meaningful that I have to share it, even though it's not perfect. Thank you for your flexibility, your understanding of, my humanness, and, mistakes happen. But anyway, I really appreciate you. Thanks for being here. Thanks for watching. Thanks for being a part of this community. And if there's anything that you need, don't hesitate to reach out. Today's guest is Dr. Tyler Lamerante. Dr.
Yep.
Tyler Lamerante.
You got it.
He's the founder and clinical director of Murrayville Health and Wellness, and which is a leading multidisciplinary clinic in Langley, offering chiropractic, physiotherapy, massage therapy, and acupuncture. Anything else?
That's it for now. Stay tuned.
Stay tuned. There's probably more.
Yeah.
So Dr. Tyler, you're a licensed chiropractor. Welcome to the show, Dr. Tyler.
Appreciate it. Look at this in person and everything.
Yeah.
It's awesome.
Thanks for having me. Happened.
Appreciate
my pleasure.
Appreciate it.
Thanks for being here. Okay, so Dr. Tyler, tell me a little bit about your background and what inspired you to bring everything together here in this space, the chiropractor, the acupuncture, massage, physiotherapy, under this one roof at Murrayville Health and Wellness.
So I wish I could take a ton of credit for being the guy that did it all. So I took over as the owner here about a year ago. When I started here, so I started here as the chiropractor about 3.5 years ago, just under 4 years now, straight out of school. So I finished my internship, and then I got hired straight out of school to work here to take over for the existing doctor who was retiring. So I stepped in, and I was the only chiro here. And then, but at the time, we had, I think we just had massage therapists at the time.
Okay.
And then I worked with the previous owners to kind of rebrand the whole situation. So we changed the name, we updated some of the clinic, and then some of the staff, and we ended up bringing some new people in. We've got direct billing, online booking, all that stuff. Kind of updated the now, I guess you could say.
Very current.
Yeah, but I think I did know that I always wanted to work with a team. I knew that I didn't want to just have like a solo practice myself.
Right.
Multiple reasons. I think number one, it allows me to sort of stay in my lane a little bit. Like, I think it allows me to also pass something off if it feels like maybe I'm not the right person for this.
Right. Which
is an interesting thing coming out of school, was I can't fix everyone.
Yeah.
Not even necessarily an ego thing, but I guess maybe it is an ego thing, but just wanting everybody to, he fixed me, right? It's like you can do it all kind of thing, and
totally.
Feeling like you want to have to do it all, but just knowing your limits a little bit, right? And sometimes that even is just, some people just need an hour-long massage, and that's better suited for what they need than a 15-minute chiro session with me. Not that, we can get a lot done in 15 minutes, but sometimes that's not what they need, or sometimes they need to work with my physio, or an acupuncturist, and they take care of all types of interesting stuff. So I think for me, I knew that I wanted to be in a team aspect. I mean, I grew up in teams my whole life, and sports and everything like that. So I think I work well in a team aspect, a team environment. So I knew that was what I wanted to be a part of. So I'll take some credit as to sort of building the team here, but I can't take full credit because it was semi-existing when I started here. But
that's that saying, like jack of all trades, master of none. And the clinic itself. Like our clinic is, we do lots of different things, and but I don't do them all myself. Like, and I think if I did, I'd be giving maybe 25%, quality in all of them. So, you have all the experts in one spot, which is great. I imagine people could spend, a little bit of time each day or a couple of times a week or something like that, in this one spot.
Sometimes we do. We go, I have people come, right from massage, and they do I call it the zombie walk, where they leave massage and they're like super relaxed, and they're like, holy smokes, and they just like kind of fall into my room and fall on the table, and they're like jello, and they're super easy. They're nice and loose for an adjustment. And sometimes same thing, back and forth with like my physio.
Love that.
Like, the collaboration is really nice. Like, we've got like a system in place where we can write each other notes, and I mean, obviously we're in the same building, so I can pull them aside real quick and say, hey, can you focus on this today? Blah, 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 blah. They need a little bit of this work. And it's like, perfect. We can have that sort of back and forth, which is super helpful.
So one of the goals of this show particularly is to break down some myths.
Of course.
So I know that there's a lot of myths in our field, and I can only imagine that there's a number of them in your field. So
oh boy.
Talk about, if you will, what are some of the biggest misconceptions that people coming in might have about some of the disciplines? Obviously, you can talk about chiropractor yourself, but physiotherapy, I'm sure there's some. Massage, I'm sure there's some. Acupuncture. Talk to us. Fill us in.
Sure. I'll try and stay out of the controversial side of things for everyone's sake, but there's a lot to be said about the chiro myths. I think we have changed a lot as a profession, or are trying to change a lot as a profession, especially in the last, I don't even want to put a number to it, in the last amount of years. We're sort of shifting focus towards, at least I hope, towards what we would call like evidence-based care. So working within the medical system, not as opposed to it, almost in a way, not being the sort of the be-all end-all of everything. I think working with the medical doctors and working with the physiotherapists and all the other people. I think, I guess to turn it into a myth, I guess, is that chiro can fix everything. And I think, I don't think that there's a lot of people that believe that. I think there's some chiros that believe that. I think there are maybe some people that believe that, but I'm going to take that on as a profession myth, almost in a way, is that hey, we can't fix everything, and that's also okay.
Yes.
We need to be able to have these connections. I mean, even just sitting down right now, right? I need to be able to have my connections in the medical system,
right,
to be able to say here, to sort of be the hub for people, I guess. Because like I said, I can't fix everything.
As we were talking a little bit before the show, right? I was, coming out of university, kind of had this like sense that we can do everything. Well, maybe it oscillates between I can't do anything or I can do everything.
Imposter syndrome. It sort of evens out as you get into it.
Yes, exactly.
But yes.
Yeah. So I guess it's important to have it, a whole assessment from multiple different angles and make sure that the person that's coming in has the rounded care, right? Hopefully this isn't offensive. A question that just popped in my mind is. It reminded me when I was growing up. So before the show, also I told you that my dad was a doctor in the little town in Ontario that we lived in, and one of his friends was the chiropractor who's literally just down the street, right? And so they were friends; they'd hang out all the time, and I had this like sense that you'd walk in, you go, and that's it. You walk out, and that's the entire. It would take like 30 seconds, and something tells me that that's not exactly how every session goes.
That is sometimes how it exists in some clinics, but not here. It's not really the way that I like to practice. I don't find that it is an effective way to treat people generally. I think people need more, whether it's, I mean, again, not to throw shade, but I think there's a lot of clinics where you don't even see the doctor. You're already face down on the table. Before he, you get the assistant to put you on the table face down.
Right.
Guy walks in, says, hey, how you doing? Blah, blah, 12 seconds of a history and assessment, and it's crack, you're all face down, and then they go, see you in 2 days, and you don't even see them.
Wow.
Yeah, you don't even see them, and then you get up and you leave and you come back 2 days later, and that's the plan. For me, that's not the goal. Wow. That's not at all the goal. I think, we spend a lot more than 12 seconds on a history and an assessment. I think that's a huge part of what we do is figuring out who the people are and their boundaries and what they're experiencing chiro or just in therapy itself, physio, whatever else, doesn't matter. What kind of experience do they have? What kind of, experiences, I guess, have they had in the past, good or bad?
Yeah.
Unfortunately, a lot of times it is bad. And so you're sort of having to, mend bridges a little bit in that field, and then just sort of building a little bit of trust back and forth, especially on day one.
Yes.
And then maybe we'll do some work on people first, we got to do, there's a lot of preamble before that. And it doesn't happen very often anymore, but every now and then you get someone who comes in that's new and says, I got this headache. Can you just crack my neck? And it's like, nope. No, why not? My old chiro used to do that. Well, we need to have a chat first. I got to make sure, right? What's going on here, right? You wouldn't bring your car to the mechanic and say, just do the thing. They're like, well, we need to assess it first, right? You would want that.
Yeah.
Same thing with your body. Of course, we're going to have to assess you and do all types of tests and have it, like I said, have a conversation first. And then sometimes, sure, maybe we'll adjust your neck that day, but maybe not.
Yeah.
Maybe not. So yeah, I think that whole 30-second treatment thing is, I think it exists still, but it's not really what I subscribe to.
Yeah. Not what you do.
Yeah. And I think so far, and again, I think this is, going back to you can't fix everyone and you can't please everybody. I think there are people who look for that, right? They are just wanting that quick 30 seconds in and out. But so far, at least the feedback that I've gotten from a lot of my patients is that they do sort of enjoy that thorough, like, let's do a little bit of soft tissue work before we adjust you. Let's do a little bit of stretching before we adjust you, right? Let's warm up a little bit.
Yes.
Right? Let's have that conversation. Let's do some questioning. Like, let's figure out what you need first before we just jump on you. Like, It seems obvious to say, but maybe you wouldn't be surprised, but you'd be surprised at how much of that does kind of go on still.
It makes me feel very comforted knowing that, that's the thoroughness is here. People are going to come in, they know what they're going to get. A lot of people might come into this work with you thinking that what you're going to, physical health and mental health being entirely separate, things, how are they very much interconnected?
Yeah, I think people would be shocked to understand how much of a deep connection there is, such a deep-rooted connection between your pain and, even just to step back and just say your physical and your mental health. just holistically, right?
Yeah.
I think it's something that maybe didn't get stressed quite enough in our schooling, because it was a bit of a surprise to me, was how many people were coming in, and it was like, wow, a lot of this is sort of beyond, again, sort of beyond what I can control here. Not,
Right.
Not to say that there isn't an aspect of that I can help, because there is, and we can get into that. But a lot of it is more than just like, this person has, a chronic pain in their low back. They just need a good crunch and it'll fix it. Like, a lot of times it goes a lot deeper than that. Generally past like the 3-month mark. This is for most things, most injuries, most pains. Past the 3-month mark, barring some sort of major injury like a broken bone or something like that, most injuries at least, past the 3-month mark, there is something more going on. Because most things heal before that 3-month mark.
Yeah.
Once you start to get into, I've had low back pain or I've had neck pain or something for 5 years or 10 years or even 6 months, right? Like, there's oftentimes a mental component to it. I'll say you can have sort of a mental component to it. I think you can also have like a lifestyle component to it, right?
Right.
Because there might not be necessarily a strong mental component to it, but if someone who, let's just say, has chronic low back pain, but they sit in a chair for 10 hours a day at work, that's obviously more lifestyle related.
Makes sense. Yeah.
Just in general, right? In general, I would say that there is probably a pretty strong mental aspect to it. Just to clarify, I do like to clarify this with my patients, because this is sort of a harder conversation to have.
Totally.
This isn't me saying your pain is in your head.
Right.
Very different thing than saying, hey, this pain you have, it's all made up in your head. It's not at all a made up pain. It's very real pain.
Yes.
But I think sometimes having to, or not having to, but being able to explain to people the difference between the tissue damage and the pain that they experience can be wildly different things. There's and I actually, so I tell this story actually pretty frequently in here, because I think it really hammers on the point. And I actually looked it up yesterday, because I was like, I want to tell this, but I want to make sure that it's a real thing. Because I think it's like, I heard it somewhere and I was like, I don't remember where I heard this. It could be completely made up. Even if it is a made up story, which it's actually not. I looked it up, I found it.
Okay.
I wanted to make sure. This big, burly, strong construction guy who steps on this like massive nail at the construction site, right through his boot. He's down on the ground. He's screaming in pain. They call the ambulance. They get him to the hospital. They finally get his boot off. The nail completely missed his foot. Went in between his toes.
Wow.
He's dumbfounded. He's like, there's absolutely no way. Like, there's absolutely no way that it missed. And they're like, look, you're unharmed. Like, you can see it yourself. You're not bleeding. You're not nothing.
Wow.
I think that right there is a pretty good analogy or story, I guess, to show a lot of times the actual pain that people experience is not equal to the tissue damage that is going on in your body.
Correct. Love that.
One way or the other. One way or the other, right? Both, dampening the pain and elevating the pain. Sometimes, again, I'll talk about the analogy of like a fire alarm. Right? We've all had it, or if we have a friend or a family member or something like that who's got a really sensitive fire alarm.
Yep, happened to me yesterday.
There you go. So like, I'm just cooking bacon, or it's like this light brown toast. Why is it? Relax. Sometimes though, that's actually a little bit, and it's a bit of a generalization, but sometimes people's brains behave that way to pain,
100%.
Where the instant that they feel any sort of stimulus that even remotely resembles pain, it sets off that fire alarm.
Yes.
That people go, oh no.
Yeah.
And it's catastrophizing, and then it leads to this pain experience that is a lot more elevated than it needs to be.
Yes.
I was this person, actually.
Oh.
So I was this person before chiro school. It's a bit of an interesting story. So I was hit in a head-on collision it's probably going back about 12, 13 years ago.
Okay.
I was hitting a pretty good head-on, both cars totaled.
Wow.
Nobody seriously hurt, but it was a pretty good shot.
Wow.
And I was taken to the hospital. I had x-rays done. I have access to the records now, and looking back now, I can see that there was really nothing seriously damaged. I had some jaw stuff that, aside from that. my back and my neck and my shoulders and my everything else like that, essentially soft tissue damage, right?
Oh, okay.
I'm a kinesiology student at the time. So
right.
I'm learning about this in real time, about how, it's, 2 to 6 weeks for muscle strains and this and sprains and that, and whiplash takes about this long. And I went on almost 5 years.
Wow.
Dragged it out. And when I say dragged it out, it wasn't me dragging it out. It dragged me out. Like it took a long time. And it was so confusing to me because I'm sitting in class and I'm just squirming. And this is two years later.
Yeah.
2 years later, I'm sitting there squirming in class. Like, why does my back hurt so bad from this accident 2 years ago? I'm reading in my textbook right now. It's supposed to be healed by now. What is going on?
Wow.
And this is not, I'm not at all going to bash anyone who worked with me at that time. I had a really good team. But one of the things that I think could have been done better is encouraged me a little bit and basically told me, hey, you're not dying, man.
Right.
Come on.
Yes.
I think it does happen where you do feel fragile. And I think part of it was that I was sort of coached in a way that I was fragile. I remember specifically being told, this is, again, years into my recovery.
Yep.
I expressed to my chiropractor at the time and said, like, I would love to do some heavy lifting and like get back in the gym. And he basically said, like, be careful. Don't do anything that's going to put some axial compression on your spine. Like, be careful with heavy squats and stuff like that, because we don't want to damage your back. And here's the thing, looking back now, like, if we switched places and I'm the chiropractor in this situation, I'm not saying these words, because now I, as a patient, believe that I'm still fragile. Oh my God. And so it was a really hard thing for me to get over, because I had this belief that I was still broken. But you could do all the x-rays and the MRIs and the CT scans of my body at that time, and there's probably very minimal residual damage from a car accident 2-3 years ago, right? Tissues heal. Had I snapped my leg in half, it probably would have been healed as much as it could have by then. You know what I mean?
Totally.
So to have some muscle strains and stuff like that by that time, I should have been better.
Right.
And so now fast forward to me as a chiro, dealing with a lot of ICBC people. It's a very hard conversation to have, but it is a conversation I have as we get into the nitty gritty of the 2-month, 3-month mark, and beyond, of people who are still in pain. And I mean, I've had people with ICBC claims that come in and their accident was 5 years ago, 6 years ago, 7 years ago.
Yep. Yeah.
I still have some neck pain from my car accident 12 years ago. And like, is anything broken? It was like, no, it was a rear ender and it's a whiplash and this and that. And so again, how much of this is tissue damage versus the pain that we experience? If it is an elevated pain experience without the actual tissue damage, how do we then try and dampen this? And this is where it's a lot of conversations. And it sometimes, again, it goes beyond me. And this is where we have to have and I do have to have that outlet to be like, I think that this would be better suited for someone like Robert.
First of all, I'm glad that you're okay.
Yeah. Totally fine.
Totally glad to hear that. Some of our clinicians, myself included, work with chronic pain, not in any way like you do, but in sense that, in some sense, there's a gap. There's an acute pain threshold when things last about, like you said, about that 3-month mark or so, 2 to 3 months.
For sure.
Any realistic injury is probably going to heal pretty much 80% at least, right?
Yeah, probably even more.
Yeah.
Honestly.
Okay. Yeah. I want to be conservative because I'm not.
But yes, but I agree.
So then after that, then we got chronic pain, and the way that I've been taught is that pain's a memory. Right? It's not necessarily, there's not the pain of the tissue damage itself, but it's the way that your brain and your body experiences the pain and then re-experiences it again and again and again. Because there's one of the things that I often talk about is, this in the head thing versus in the body thing. And I've thrown that out years ago, because I don't believe anything's out here somewhere. It's literally physically in the brain, physically in the body. You feel your feelings in your body, you experience your emotions in your body. And so, all these, memories have, memories in the body, right? So there's an inflammation response and all that stuff, that's going on, and pain, experience. I'm pretty sure that the same region in the brain, I think it's a cingulate gyrus, experiences both emotional pain and physical pain at the exact same time.
Your body doesn't know the difference.
And so here we are, where is the difference here, right? So I think it's really important then. Thank you for touching on that. Once we get past that 3-month mark, we want to be looking at some other resources in it, and maybe it's a mental health therapist, maybe it's acupuncture, maybe it's whatever else it might be. But I think it's really important that you touched on. I think
sometimes it is coaching as well, and coaching and education. And I think one of the things that for me on day one, speaking of the history and the assessment and stuff like that, I think one of the biggest things that I really focus on day one for people is allowing people or helping people understand their pain.
Right.
Almost every single time I will pull out my laptop and I'll pull out some anatomy photos and, obviously in layman's terms, but I need people to understand where their pain's coming from, at least to my best understanding as well, right? I can't be perfect every single time, but to my best understanding, right? Because I think it demystifies, to use your word, their pain. And so frequently I have people who come in at like an 8 out of 10 pain, and without even getting my hands on them, just doing a quick history and an assessment and then being like, I know what's going on. And then they go, really, you do? Let me show you. And then it's like, this is the muscle. You got a spasm in here, and that's why it's causing this radiating pain going into here. The tingling is because of this, and this. It won't take too long. Like, don't worry, you're not dying. This is about how long it usually takes. You'll be shocked at how fast this goes away. Give it 72 hours. You'll be a brand new person, blah, 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 blah. Here's what I'm going to do for you. And this is how we're going to do it. And then they go, really? Oh, I feel better. Well, we haven't even worked on you yet. We haven't even worked on you yet. And they go, oh, really? Oh, okay. Oh, thank you. And then it's a lot of times that person could probably leave the room and be like, oh, I feel better now. But a big part of that is sort of, again, it's an alarm system from your brain, right? I've heard the analogy of the engine light turning on, right? You don't know, right? Pain is an engine light in a way. It could be a lot of different things. It could be a lot of different, serious or not. And so it's just a signal. Your body doesn't know. So sort of normalizing that, get the code reader out and see, right, what is actually going on here. And if it's nothing, you just turn the gas cap, tighten the gas cap, and the light goes off.
You also mentioned the last thing you said was about belief systems, which is something very, very important and dear to my heart. Is that what we believe about ourselves. We're phenomenological beings, that we live through the world and we see the world through our own eyes. So we're always thinking about how we're filtering everything through our own senses and our personal being. So I imagine that you're coming to see a chiropractor, there's a belief system about yourself, at least at this point in time, that there's something's wrong with me at this point, of course, right? And probably to some degree I'm broken. So then to have somebody like you have a really clear treatment plan, right? Fairly soon you take a thorough history, you take that person's leaving going, oh, I guess there is maybe some hope here for me. 100%. And that hope is just so valuable that people, indeed feel better. Like sometimes we do treatment sequence planning and we like set the foundation. We don't even actually do a lot of the work just yet. We maybe teach like a breathing technique or something like that. Just what I say, learn the brakes before you hit the gas, and then people will leave and they go, oh, I feel so much better. But really, we haven't done much.
It's just the intro, but it's great. Yeah.
We look at a somatic focus. If the person's like, I don't know what's wrong, I don't know what happened, but I just have this like pain. Sure. How do you handle that?
I think it depends. It depends on the case, I guess. Well, let's make up a patient. These typically work better. So let's make someone up and say, what do you want to do? Headaches and neck pain.
Yeah, that's a very common one.
Very common one. Yeah. So headaches and neck pain. So it's always going to come down to an history and an assessment. Figure out what is going on. Is this something that I can deal with? If it is, fantastic. Well, even if it's not something I can deal with, let me explain what's going on to you, right? And then is it something I can deal with, or is it something that I can't deal with? Or not even is it something I can't deal with? Is it something that I feel is better suited for someone else, whether it's in this clinic or not, right? There's occasionally, right, with let's just say neck pain and headaches where it doesn't happen very often, but every now and then you get kind of an icky feeling and you go, you know what? I think that we're actually done here today, and I need you to go over to the hospital because this feels a bit something that doesn't feel right to me. And so even in that super extreme case, but in the case of the clinic, I guess, people who have, let's say, tension type headaches, right? It's the most common type of headache, right? You're stressed from your terrible job and you do this and financial stress, whatever it is.
Totally.
And they walk in and their shoulders are their earrings and they're like, I don't know why I have such a headache today. And you're like, well, first of all, let's get those shoulders down. Oh, that feels a bit better. Yeah, no kidding. They're clenching their jaw and they're like, I don't know why I have such a headache today. And it's like, in that case, I do think that, I do get those patients a lot and they do respond really well to chiro, but that's a perfect case of someone's like, I think you should go for some massage. Why don't you, before you leave today, why don't you go talk to one of my girls before you leave and just see if we can get you scheduled for massage in a week or two? Because I think that would probably do you best in this case, right? I think that's a really, that's an easy example of, pretty much a daily that I see in here.
Amazing.
Where, again, not that I can't help them, but I think the combo of sort of working with another practitioner in that case is super helpful. Acupuncture is another one, right? Like I see all the time. I like to refer to Andrew, my acupuncturist. I like to refer to Andrew for the weird stuff. Or a lot of times the chronic weird stuff too.
Okay, like
right?
What? Give me an example.
Digestion, anxiety stuff, or the odd stuff. Sometimes headache stuff that just feels like they've tried everything. A lot of times acupuncture is a good one for that. So, and physio is my favorite thing to refer to. Physio is typically if people need longer sessions to work really like post-rehab or post-surgical rehab and stuff like that. Right. He's got all the types of the tools and the gadgets, right? And in a little bit longer sessions than I would have. We sort of have our own sort of niche specialty, I guess you could say.
I love that. And also sounds, what I'm piecing together here is that you would likely consult with each other a little, right? Let's say that we do. We've got like over 50 years of combined experience, so why not tap into that? 100%. We can, right? So absolutely, I think that's terrific. At least with counseling, there's for sure a stigma around seeking a therapist. Like there's something wrong with me if I need a therapist, or I'm crazy if I go see a therapist. Thankfully, maybe things are slowing down a little bit and they're changing with our times, thankfully. But talk to me a little bit about what are some of the common stigmas that you get when people come in to see any of your practitioners?
I mean, I actually like to sort of dig into the counseling stuff a little bit actually in my clinic, because it does come up actually somewhat frequently. Murrayville here is primarily, I guess, maybe I don't have the statistics. At least traditionally, it is a little bit of an older community. There's a lot of seniors and stuff like that, middle-aged families and stuff like that too. But I think having that sort of destigmatizing sort of conversation, exactly like you just said, I think it's funny because I think you probably get this from the opposite end, maybe occasionally, but I tell people all the time, like, it's the same reason you don't need to be broken to see a chiropractor. You don't have a broken back to see a chiropractor, or have debilitating sciatica to see a chiropractor. Sometimes you just want to go in for some maintenance. Right. It's the same reason for a counselor. You don't have to have a broken brain or be crazy to go see a counselor. Sometimes you just want to go and have a chat and have an unbiased outlet for that. You don't have to be a crazy person for that. And that's actually frequently a conversation that I have in here, because again, I think you're right. I think it is slowing down a little bit. But yeah, I think it's a conversation still very much worth having, especially with certain demographics that maybe are a little bit more traditionally rooted and stuff like that. They maybe didn't do, counseling wasn't a thing potentially, right, back then, or it was sort of stigmatized a little bit. So I think having those harder conversations with folks about that, I think especially in the mental health side of things, that is definitely one of my favorite things to talk to people about in here.
You said earlier too that you'll bring over your laptop and you'll show some of the evidence for certain things. And
the anatomy of it, right? Like here's the muscle. Here's literally the muscle that is bugging you.
This right here.
Yeah, exactly. Yeah. I use my spine guy and show them like this is I think what's going on, and you have some narrowing here and that, right? Yes. Again, it's for understanding purposes. Yeah.
50 years ago there was a lot less evidence for a lot of different things. And 100 years ago it was just like you got. It was just so woo woo, and now everything's even I do EMDR that I specialize in specifically, and that 10 years ago was woo woo, and now there's all kinds of extra evidence for it being like really quite physical. So I imagine that I think a little bit earlier we were mentioning a little bit about the how your field has evolved as well too, right? And I think that's so helpful to probably shift some of the stigmas. Like, no, it's actually, there's a physical thing here. You're not just making it up, or I think that's so helpful.
For sure. I think it's in a way, it's kind of funny where you probably have to do this as well, where I talk to people about how I know how strange chiro is. Kind of address the elephant in the room, where sometimes you just got people in sort of a weird pretzel move, and it's just like, I'm working on an inner thigh, or, I got a knuckle in the butt cheek, and it's like, hey, I get it. This is a weird thing. And I mean, even in your case, right? Like sort of address the elephant in the room. Like, I know this is going to seem weird, but
Yes, especially with my EMDR. You know,
Exactly.
Like, you know, for most people that don't know about it, like you'd be waving your hand back and forth, and the client's following it with their eyes. It just looks so silly.
Yeah.
You know, like my story, and I won't get into it really, but I almost did not do the training, so that's so
There's no
silly.
way.
I almost walked out. I was like, I can't help people like that.
Totally.
And it turns out it was incredible.
Yeah.
But you also said something, and I don't want to miss it because I think it's really, really important. You know, a lot of the people that tune into our show here are interested in therapy and mental health, and there will be a lot of trauma, you know, that people experience, and I think particularly with your field, even more so than with our field. I mean, with EMDR, I might tap a little bit on. I'll get permission first, and I'll tap on their hands, maybe on their knees, particularly. But with your field, you know, you're actually physically touching these people.
Very hands-on.
And every one of your practitioners are doing that. So can we just pause for a second and talk about consent, you know, physical touch, because I think that's so scary for so many people, right? The number of people that have been, you know, assaulted or something, you know, by a massage practitioner or by a doctor. I mean, it's in our field, you know, it's got to be in your field too. How do you create that sense of safety for people just to know that, yeah, I'm going to touch you, and this is how I'm going to touch you, and where I'm going to touch you, where I'm not going to touch you? Talk a bit about that.
Yeah. Maybe shockingly, maybe not. At least a couple times a month, I have someone who comes in as a new patient and tells me, hey, just a heads up, I'm here because my husband said you're good, or, you know, my neighbor says you're good or whatever, but just a heads up, I've had a bad experience in the past, whether it was a chiro or whatever, right? And just a heads up. And I think for me, a couple things. Number one, doctor-patient trust, right? So again, that's where this conversation needs to be had from day one, that people can have a conversation with me and realize that, you know, just having a little bit of a dialogue. Sometimes it's related to the case that is in front of us or not, and sometimes just having a dialogue and just gaining that trust with people. Something that I tell everybody all of the time is that you will not find me being pushy in terms of like what we want to do for treatment. So for example, some people have neck pain, and people will say, I have some neck pain, but I actually don't like to have my neck adjusted. And I say, yeah, that's totally fine. For some chiropractors, that's blasphemy. But for me, it's like totally fine. I get it. Like, I get it. It's weird. It's weird. It's strange, and that's okay. There's more than just cracking your neck that we can do to help you get better today. I joke around all the time. My mom doesn't let me adjust her neck. I know it's not a me thing. It's not a personal attack against me. I know it's strange. It's okay. So again, not pushing people beyond what they're comfortable with is super important as well. And just outlining that right away from day one is like, if you don't want anything done, we're just not going to do it. And then sort of the last thing I always tell everybody is no surprises. So I'm not one of those maniacs that's just going to put you on the table and spin your head around without any warning. We will talk you through the process. And I've heard a million stories of exactly that, because you're like, there's no way. Oh yeah, it happens. It happens. It happens. It happens. It happens. I tell everybody all the time, and this is not only just day one, this is every day going forward. It's like, if we're going to do something, I'm going to let you know that we're doing it, just so you know, right? Not in a weird way, right? Like, I know, you know, it's like when you're learning to drive and you're 10 and 2, right? And when you're in school, when you're in chiro school, they tell you like, you know, use certain verbiage to, you know, if you're going to work on someone's glutes or their, you know, their hips or something like that, you want to use certain verbiage. And I think that works for some people, but I think as long as there is an established trust and you are just, you know, verbalizing what you're doing, you don't need to be a robot about it in a way, but, you know, just, hey, I'm going to work on your hip a little bit here. Just let me know, basically keep me updated, and having that sort of ongoing dialogue. Again, not only just day one, but every single time these people come in, having this sort of ongoing dialogue of sort of, hey, I'm going to do this. Hey, I'm going to do this. Let me know if my pressure's too much. Let me know if you need more, less. I don't know why it doesn't happen more, but that I think a little goes a long way in these cases, right? In terms of trust and just having that dialogue during a treatment. It's crazy. It's crazy how much of that doesn't happen, and then leads to these gray area cases where people just like aren't sure of what's going to happen, and then it leads to something that they weren't necessarily comfortable with, and then it's trauma, and then it's now I'm never going to a chiro ever again.
I'm getting the sense that, you know, there's like, you're really setting a standard here of the way this sort of treatment needs to be. And, I think that, people move around sometimes. They'll be your patient for a while, they get better, and maybe they go move to a different country or something.
Yep.
But now to have that in their mind is that this is what a good chiro does, right? This is what a good massage therapist does, and this is how it should be. I think it's you're saving people from potential, calamities outside, in the future, that if something's not like this, then you might want to, talk to somebody about that. So
100%. Yeah.
Thank you so much.
We talked about this a little bit before the show, and I said, like, I feel like the bar is too low sometimes. Like, hold your practitioners to higher standards. Like, if you're not getting what you think is proper treatment, like, either say something or go somewhere else. Like, I don't know. I don't know why we have such a low bar for what is being, it's our health. Like, if there's no lack of choice generally, right? Like, obviously, you're in a small town or something like that. You can only get so much, but there's 4 clinics in Murrayville here, like, and you might just be better suited off with someone else, and that's okay.
Totally.
But hold your people to higher standards.
Yeah, I love that. With as a group practice owner with different types of clinicians and practitioners, one of my standards, and I think I'm hearing this from you too. One of my standards is, if I wouldn't refer one of my family members or see that person myself, if obviously the dual roles couldn't do that, but if like one of my therapists, I was considering taking her on as my own therapist, and then and I was like, I think you can help more people if you were working for me, so I got a different therapist. But that's my, if I couldn't refer a friend or a family member to this person, they're not on my team. So imagine the same for you. I told you already. I said I had to dig around a little bit on you because I wasn't sure, right? Like, we're a fairly newer relationship, and I said I want to make sure that if I'm working with Robert, I want to make sure that he's legit and he's he's good at what he does, and he's not one of those. Because I don't want to sit here and have this connection and send some of my patients potentially to you if I don't think that it's going to be a good fit, because and vice versa. I'm already thinking of my clients right now that need to see Dr. Tyler. Okay, let me ask you another question here. If you were to build an ideal integrative wellness experience for our community here, where mental health, and physical care were to work seamlessly back and forth here, what would that really look like for you?
I think it's sort of having an ongoing relationship. Let's just say it's me and you, right? If it is me and you, I think, well, first of all, having that trust right back and forth, that I know that if I send this person who is potentially vulnerable, that you're going to take good care of them, and vice versa, right?
Correct.
And then just being able to have a good collaboration, I think, right? Like, again, you're the expert in yours and I'm the expert in mine, and it's it's not up to me to be like, I think that this person needs this, but being able to sort of bounce back and forth, like, hey, what about this and this and this, right?
Yes.
I think one of the biggest, I think there's 2 off the top of my head that we would really, I think I see the most frequently. And number 1, it is chronic pain patients, like you had already said, right? Because of how, everything we've already talked about, but just how deeply rooted chronic pain and mental health and depression and anxiety and this and that, and how closely connected they are. And really just, you're just not going to get physically better unless you sort of dig out some of the stuff that's a little deeper than just the physical, my shoulder hurts.
Yes.
So the chronic pain patients, and I think the ICBC patients, so the car accident patients, and again, I was one of them.
Yes.
So had I potentially been able to get connected with a counselor to talk about some of these things, why am I not healing? I'm 2, 3, 4 years into this. What is going on?
Yes.
Right. And to sort of maybe be able to dig out some of those like chronic pain things and the, catastrophizing and feeling fragile and this and that. I think those are 2 super strong candidates, I think, for this sort of collaboration of like, yes, you need to get better physically, and you need to be, you need some coaching in terms of exercises and this and that, and you need some hands-on work, but also there's something else you should probably have a conversation with. And it's something I actually do mention with pretty much every single one of my ICBC patients. And it is actually covered under ICBC as 12 counseling sessions. And I think people should absolutely take advantage of that. Even if you don't think, if you don't think that there's anything necessarily going on up here after a car accident, tell me you don't look extra, extra when you're turning, right? Like you're probably, whether or not, hanging on to something. And it's probably leading to a little bit of extra pain because of the traumatic nature of the accident. So
that's right.
Yeah, that's kind of where I would sort of focus, I think, is but again, this doesn't necessarily just have to be these two types of patients. This can be anybody.
It could be anything, you know, like you're working on somebody and they're talking about the relationship, right?
100%.
And you're like, well, that's not really what I would do, relationship counseling here. And then, obviously that would be a good referral. But I think all of these things really work out well. And because of our relationship that, you know, that we're creating here, and I can imagine, you know, picking up the phone, giving you a call, and just have a really quick, you know, consult with this 100%. Person ahead of time.
Absolutely.
So that, you know, people know that, like, they're not just going to this random clinic, you know, and they're going to be seen by whomever, and like it's just like they just disappear into these ethers somewhere. One of the things that we do is we send out progress reports, you know, to doctors or to whoever else, as long as, you know, the client gives us permission. Of course. And then you know that, okay, things are progressing over here, and so then if their physical pain's not improving, and we've sort of, you know, given them the clearance, they're good, you know, mentally, emotionally, then there's something else, you know, kind of check things off. And I think this is a really good, you know, continuum of care that we can make sure that, okay, maybe it's something else that we need to look for, like a, you know, a naturopath now maybe, or something like that, and we can sort of make that happen. So I think that's a really great way of looking at it.
Awesome.
I agree. Cool. Sometimes we get families, you know, and you know, unfortunately, when people get in a car accident as a family, it's not just the one person, right? So
a lot of full family situations. I think that's just naturally kind of word of mouth, right? Like, you know, you get one of them that comes in and leaves feeling good about what just happened, and so they're going to send in their partner, and then they're going to send in their two kids, and then this the neighbor, and this, you know, Sally and whoever, and that. Yeah.
Isn't the best, I say this from a business standpoint a little bit as well, but sometimes I get the question from my clients, you know, how can I convince my partner to do this work, right? Because I'm all in, but my partner is like, I don't know about this guy. And my answer is always, you know, you're the best marketing. For sure. If you're ready to go, you come in, get your work done, and then after that, results. You know, when you feel that results speak for themselves, you get the same thing, eh?
Yeah, typically. And there is a one step further. I always tell everybody, like, if you think that, let's just say your husband in this case, you know, he's always groaning about his low back, and it's like, I want to get him in here. It's like, why don't you just send him in and we'll just have a chat. We won't even treat him that day. I'll do it for free. I'll block off some time in my schedule, send him in. I'm not here to do a sales pitch, but this is, you know, we can have this conversation of like, this is what I think is going on. This is what I would love to do to help. You know, these are the risks involved, but these are the benefits, and then it's very much balls in your court. If you would like to, I'm here, right? If you don't want to, that's also okay. But let's also discuss, like, you know, if you have had low back pain, like, what are we going to do about this? You don't have to live like this. And even if it's not with me, is it someone here? Is it someone else? Do you just need to get back in the gym, right? And so again, a lot of times it's just having that conversation. You're right. I think the results do typically speak for themselves, and most of the time that is sort of the way it goes. Is people leave and they go, wow, and then they go home and they tell their partner and they go, this guy's awesome, or whatever, right? And then that person comes in then the following week, and I go, hey, you're the other half. Hey, great to see you. But yeah, I think a lot of times you just have to lead a horse to water, right? Like if people want to or don't want to, that's up to them.
Your job isn't to convince people or, you know, to sell them on this treatment. So it's basically a free consult, essentially, is what you're like. What we offer a free 20-minute consult, and it sounds like you're kind of, you know,
very
people
open
come in. So then when they make the decision, you know, to get this work done, then they're consenting to it, and they want to try it, and
up to them. I'm not pulling teeth to get them in here. Exactly. Like, if you don't want to be here, don't come in. It's not my back that hurts. It's right. Like, it's totally up to you. It's totally up to you. And again, that's also okay. Like, don't take this as a slight. You don't have to come and see me even after a consult, and you're like, you know what, I actually don't think that I want to. It's like, that's okay. Okay. But what are we going to do now? How are we going to get you better? It's not with me, but how are we going to get you better?
I love that.
So
love it. This question just popped in my head now. When people want to come here to see you, do they need a referral, like, from a family doctor or anything? They can just come in and they can.
Generally, I think there's very few cases. The rare case of like a work safe claim, right? Sometimes that requires a little bit more paperwork on the back end, but an old ICBC case, you know, sometimes that. But the general population, you tweak your back, come on in. Love it. If you have insurance, we can obviously, you know, generally we can bill that. But yeah, I mean, there's MSP coverage as well, which a lot of people don't realize. So it's based on income thresholds. And so based on sort of your last year's income, if you are under a certain amount, they consider you lower income, and then you can actually get a bunch of your visits compensated partially, almost like you have like an extended health benefit.
Like reimbursed, you mean?
We bill it directly. So depending on the practice, I as a chiro, I direct bill the MSP stuff. So it ends up actually being less than half the cost of, and it's not any less, you're not getting half the work done or anything like that.
Feels like barrier to, for people accessing this incredible care is way less.
That is, and I mean, I'm sure that's, again, I know that's another barrier, of course, right? Both of our lines of work is that sort of that income side of things is shit's expensive.
Yeah,
right?
Life in general is expensive.
Life in general is expensive,
and like you mentioned, like the lights don't just stay on here. They cost money to put it on. So of course, there's a business side of things here, but I can really feel that your heart's in the right place, and it seems like you're pulling all of the different levers you possibly can, just like we do, to make sure that people can, cover as much of this as possible, so that the impact is, digestible, right? I love that.
And even in these cases, right? Like even in these people who they necessarily, they can't necessarily afford to come in, once a week for a few weeks, right? Like, okay, well, we know this going in. So a lot of what I'm going to focus on that day is how can you get better on your own?
Oh, I love that.
Right? Because I have to make sure that you leave with some homework and some stretches and maybe some exercises so that, right? Like if you can't come in and get some work done, generally people are going to leave with that stuff anyway, but especially in these people where it's like, I know I'm not going to see you probably for another 3, 4, 5, 6 months just because you can't afford it. And I get it, but okay, what can we do today to see if we can get you a bit better? But then also it's like, where are you going to go from here without me? I always tell everybody too, like I'm very much reachable. If you need to contact me, shoot me an email or whatever. But people need a little bit of guidance and I think the putting a little bit of the onus on them to get themselves better too, right? And again, that's not just for these people that can't come in. I think it's a funny thing in both of our industries actually is that we make money per visit.
Right. Yeah.
And again, hopefully this isn't pulling back the curtain too far here, but I think it's absolutely a conversation that should happen is that like a lot of things, we don't make an hourly wage generally, like some exceptions, obviously, we make money per patient. And so it's kind of this weird sort of like ass backwards thing where almost like the better you are at your job, the less money you make, right? In a super simplistic viewpoint, right? If someone comes in with shoulder pain and they see Dr. 1 versus Dr. 2, and Dr. 1 gets them better in 3 visits because they're really good at their job and they're really encouraging and they give them exercises and this, and Dr. 2 says, oh, you're going to need to see me 3 times a week for 6 weeks and you're going to see me 2 times a week because your shoulder's broken and it's never going to get any better unless you see me this many times. Dr. 2 made a heck of a lot more money. But something that's really come up a lot in my thinking is the way that I sort of go about it is thinking about building my clientele wider and not taller. And so you don't necessarily need to see someone with shoulder pain, 200 times to get them better. But if you get them better in 3 visits, they're absolutely going to tell the next person that they see going like this.
Correct.
And they go, hey, you got this thing. I had this thing. And I got this guy. And then now you've got people who are coming in to see you because they, I don't want to say want to, but you know what I mean?
Yeah.
Not because they have to. I guess it is kind of a little bit, but because they're being forced to come and see you.
100%.
They've got a guy that they can come and see when they've got something going on that's going to give them an honest opinion of what's going on and trying to actually get them better faster.
I love it.
So like everything else, sort of having a person who is going to be honest with you and everybody sort of needs to have someone in their life. I joke all the time with patients that like everybody should probably know a mechanic that they trust, like an electrician, a plumber, someone in the medical, physical therapy side of things, whether it's a chirophysio, whatever, right? Someone you should probably know that you can go to that you trust, right? I tell people all the time, I don't know anything about cars. I'm a total car dummy. My Jeep's making a funny noise. I bring it to the mechanic and I go, here you go.
Yes.
Tell me. And if they pull out some big words and they go this, and this, you're the boss. You're the boss. I trust them, right? And that's where you need to have that trust. And people, a lot of times I think people think they know what's going on in their body.
Right.
I think they feel what's going on, but the same thing, like feel your car's not quite driving right, but sometimes having an expert look at it is a different thing than what you think is actually going on. And so again, people come to me and they go, I've got this pain and I don't know exactly what it is. And if, I mean, you know, you need to have someone who is going to tell you honestly what it is and who's going to be able to fix you in an honest, you know, proper way.
Yes.
And not take advantage of you. So
I love that. And I think that there's a safety thing here and trust, you know, those go hand in hand. And there's a bit of this understanding and trust in your patients. And this is the thing that we're highlighting here, is that, you know, you're not going to steer them and keep them here any longer than they need to be here, right? Same, it's like we'll do the same thing. Like we want them, honestly, we would love for our clients to be better as fast as possible, and then in the best way possible, never see them again if we don't have to.
Yeah, I joke with that all the time. Yeah, no offense, great. I don't want to see you next week though. You know? Like, no offense.
Happens,
people say it all the time too to me. They're like, how you doing today? I gotta come up with a better, you know, like greeting, because it's like, how you doing? It's like, terrible. It's like, yeah, I guess that's why you're here. But yeah, it's true, right? Like people don't want to necessarily see me all the time too.
Right.
Like,
exactly.
Yeah, we get you better. It's like, you know, if I don't see someone for a full year and then they come in like, hey stranger, how are you? Like, typically either things have gone really, really good and they're like, I haven't needed you. It's been awesome. Last time you did really good and you gave me some good stuff to kind of manage it and blah, blah, blah. Or, you know, there's the case where it's like, it's been terrible and I had to go, you know, this and that. But generally you're kind of hoping for that. Like, I haven't seen them in a year. Hopefully it's because they've, you know, been doing really well. And what we talked about worked. And those are the best.
The emphasis on trust and safety are just astronomical. And I love, you know, what you said just a couple minutes before too, is just being really, if your patients are open and transparent and like, look, I can only do this for like 4 sessions. And then you're going to take that into account as to what the treatment plan looks like. Very similar to what we'll do. So I know that's a really admirable thing, I think. And you know, you're not trying to force people to stay any longer than they need to. So I think I feel very comfortable referring our patients to you.
I think, and by the way, I think that people, whether they know it or not, I think people can feel that. I hope at least. I think that people can feel that. I have had people talk to me about this and say like, yeah, I used to see this guy, but like, why did he every 3 days I needed to come in for that long? Like, why? A brief story I'll get to here. Super nice young girl who was being treated by a different chiro who was having her in like 3 or 4 times a week. So she has a mild to moderate scoliosis, but young athletic girl. And she was told by her medical doctor when she was a teenager, when they saw her scoliosis, the wording that the doctor used was something along the lines of like, you have the spine of a 65-year-old farmer, something like that. Imagine telling this to like a 13 or 14-year-old girl, right? Who's probably in pain because of her back. And then now, right, we talk about telling people that they're fragile and broken and this and that. Like, this is their doctor that's telling them that. So of course they're going to believe it. And they feel it too, right? So, you know, and then now, so, you know, years later, she goes and sees a chiro because she's having some back pain. And he is, you know, 3-4 times a week and she's not getting better. And she went for, you know, extended health benefits don't cover 3 to 4 visits a week for very long. I tell you that. So even though, you know, someone has benefits, they don't last that long when you're going that frequently. Anyway, she came in to see me and she told me all this, checked it out. And I was kind of poking around. I said, you've got scoliosis, but like, does this hurt? And she goes, oh yeah. And I said, yeah, okay. That's a specific muscle that oftentimes is quite tight when you have a scoliosis. And this is what we're going to do for this. And I'd like to do this and we'll adjust you today, but I want you to try these, you know, these 2 stretches at home and then try this 1 exercise in the gym. Maybe come back and see me in like a week, but just so you know, like you're okay here. And crazy, she left and she came back like 5 minutes later and she came back in and just said like, I just wanted you to know that you're the first person who's ever told me that I was okay. It's crazy. No joke. I saw her about a month later in the gym and she's like, I'm doing awesome. Like I've been in the gym since. And like, I see her like occasionally, but not 3 to 4 times a week. I can tell you that. And I think, again, did I just fix her by cracking her back? Probably not. Did it help? Sure. But like ultimately the thing that probably fixed her in this case was just somebody being like, hey, you're good. Like everything that you've been told about this 65-year-old spine of a farmer and blah, 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 burn that. Burn that. It's garbage. It's garbage. And that doctor should never have said that. that chiro should have never taken advantage of you like that. Because shocker, 3-4 times a week with this chiro, not once were they given stretches for at home, not once were they, told us, hey, maybe you should try strengthening this muscle. It was come and see me because I'll fix you, but it's just going to take a long time. So,
oh my gosh, wow.
Yeah. And I mean, that seems like an outlier case, but it's really not. It's more frequently than people believe. Is that they really, and again, whether to their credit, they've probably been told this by a professional that they're basically, in other, different words, that you're broken. And then believing it.
Yeah.
Because why would you not?
Why not?
If I take my car to the mechanic and he says your car's broken, I'd be like, yeah, probably.
Oh
You're probably right.
Wow.
What's it going to be to fix it?
Wow.
So yeah, just having someone sometimes to say, hey, you're good. This is what's going on. This is how we're going to fix you. Made all the difference. It's crazy.
Tear up a little bit.
Sometimes just having a small conversation about people's lives. Yeah, and how they feel, and again, things that they've felt for years.
Amazing. And
but being able to, I don't want to say normalize it, but demystify it in a way, right? Demystify it in a way, and the mystery about their pain is oftentimes a big component of how much pain they feel, and then sort of understand it.
Totally.
Yeah. So
when you don't know,
it
creates more anxiety for sure. 100%. Totally. People that are watching or listening,
sure.
If they're unsure about their physical or emotional or both that side of things, what advice would you give that person regarding maybe their first steps towards healing?
If they have someone that they trust, like we sort of have already talked about, if they have that person, go to that person.
Yeah. Okay.
Right. Find a person that you trust in the therapist side of things, whether it's mental or physical, chiro, physio, counselor, whatever.
Yeah.
Find a person that you trust and hang on to them.
Okay.
Because I think any good practitioner will be able to distribute as needed. Right.
Oh, that's a good point.
Right. And then and again, a good practitioner will have the web of connections to his colleagues and stuff where, even if it isn't me, if it isn't you, it's going to be someone that I know, or it's going to be someone that we will figure it out for you.
Yeah.
But it's just taking that first step to sort of like address this problem, right? Like I tell people pretty frequently too, like it's not your job to sort of figure out what's wrong with you. That's okay.
Yes,
like it's okay.
Yes.
Like use the resources around you, right?
Yes.
And find someone that can, and then trust the process, I guess, at that point, right?
Yes.
If it is someone that you trust, then trust that they're gonna look out for you.
I love that. Okay, what about the person that doesn't have anybody, or at least they don't think they have anybody? Their first time.
Yeah.
What do you say?
It is hard. Word of mouth. So whether it's like community Facebook pages and you're just sort of asking around, actually my name gets tossed around. It's probably one of my biggest like word of mouth generators, I guess you could say, is like community Facebook pages, because people will say like, anybody who should I go see, right? Yeah. Like, hey, I got this thing going on with my back. Does anybody know? And it's a lot of times it's like, I don't even say anything. I just sit back and let people talk, right? Because and if there's 20 comments and 10 of them are say, go see Dr. Tyler, he's awesome. Great, that's awesome. So I think community pages, whether it's forums or whatever, right? I think you can always reach out to certain clinics in the area and just sort of do. If they're willing to do a consult, like we were saying, right? Like a quick, hey, do you mind if I schedule something with your chiropractor just to sort of have a chat, maybe 10, 15 minutes or something like that? I just want to explain kind of what's going on. Is that okay? Do they do that? Is that, and if not, then that's okay. Then phone around. Phone around. Again, I think a lot of times with these fields, it's not, sometimes this isn't the case, but I think frequently it's not for lack of choice, right? Lots of chiropractors probably in your area. There's probably a lot of physical therapists, physios, right? So yeah, if you go to one and you just get weird vibes or something doesn't feel like it's a good match, that's okay. Someone told me one time that when you book a therapy appointment, a counseling session, you should book it with 3 different practitioners. First session with 3 different ones, because going to one is not necessarily going to be the one that works for you. And the amount of times, and I'm sure you've heard this more than I have, is I've heard people say like, I tried counseling and I don't know, just didn't mesh well. And it was like, Okay, but that doesn't mean that counseling's not for you. It just means that the person that
Right.
you got matched with just wasn't a good fit.
Correct.
You can try someone else. And it's
Yes.
the same thing in my world is, you know, just because you've been to chiro once and it wasn't a good fit, you know, you can try someone else. But yeah, in this case,
that.
just to sort of bring it back here I think you can ask around. So word of mouth, whether it's family, friends, community pages, whatever that is, or phone around and just dip your toe in here, dip your toe in there and find someone. And if you find someone that you like, hang on to them real tight. Because it's pretty important, I think, to have that in your life for when inevitably something does come up.
Life happens, and
inevitably
it's good to have the people like, you know, maybe not necessarily a speed dial, but like, you know, really, really handy that you can reach out to. I love
have a practitioner that is that you can go to with stuff. I had a lady come in just recently, and she's like, I wasn't even sure if this is a you thing, but like I hurt my toe. And she's like, and I wasn't sure, but like, you're my guy for this type of thing. So I was like, I just came and see you for my toe. And then it is very much in my realm. So I was glad that she did. Yeah. Oh, of course it is. Yeah. Oh yeah. Everything head to toe. I fixed her toe. I helped her fix her toe.
Yeah.
And she's like, yeah, I knew it. I knew it. Right. But again, that's where you just sort of have a guy or you have a girl. That's your person. And you can go to them when you have stuff like this come up inevitably. Again, we're all going through life, and we're going to have things come up. Physically, mentally, whatever it is, no one's immune to it. You see, if you watch any sports, you'll see on the ticker, it's like even these professional sports athletes, LeBron James out 2 weeks with back spasms. It's like, hey, if it can happen to LeBron, you know, why can't it happen to you or me? Like,
absolutely.
Nobody's immune. So we're going to need it. We're going to need some sort of help at some point.
Oh, well, I really love that. And I really love that you did this interview with me. And thank you for spending this time. Of course. And opening up your clinic on a Sunday. I really appreciate that. Of course. You know, you can know that Dr. Tyler and his team's definitely trustworthy. We actually have you on our community connections page on our website, because that's the people that we trust in our community, you know, that we've had, you know, some sort of interaction with, and we know like they're legit. They're gonna they're not gonna take advantage of you or something like that. So so you can find your website there, but also websites
Murrayvillehealthwellness.ca. Yeah, my email is Tyler. It's a bit of a mouthful. Tyler at Murrayvillehealthwellness.ca. Phone number 604-532-9887. Yeah, reach out however you need, even if it's just to have a quick consult and see if maybe this is right for you.
Any last words that you want to share with the audience?
No, I really appreciate you having me on. I think hopefully people get something from this, whether, you know, education-wise or, you know, if they found it entertaining or whatever that is. But yeah, thank you for having me on. It was definitely a new experience for me, and I think pushing me out of my comfort zone a little bit was good.
You know, the trust is so critical. Finding that doctor, finding that team that you can really rely on, that you know that they're not going to steer you in the wrong direction. They have your well-being in their heart. Clearly is you know, felt here. You know, they're here to help. So thank you for doing it.
Thanks,
I
Robert.
appreciate it.
Appreciate you.
Okay, and for you watching, tuning in, see you next time.